Hello, everyone. Welcome. We have just opened the Zoom meeting. It just turned 12 noon in Eastern Standard Time, and we'll probably wait a minute for people to come. So in the meantime, you are welcome to use the chat box to just let us know where maybe you're calling in from, if you want. And you can always use the chat box to type us questions as we go. It's myself and Maggie leading the call today. We'll start in maybe a minute or two. There's an echo on the sound. Are there other people hearing that? Okay, well, we'll get started. If you might have an echo, you might have two devices set up, and so maybe you need to mute one. And if I'm not mistaken, everybody is muted. Maybe if people aren't speaking, they'll be muted. Okay, let's get started. Well, welcome. If you're want to send us questions to the chat, you can throughout. We will be looking for that, and love to hear where you're all calling from. We are here today. This is being recorded, so you can send it to your colleagues. But we are excited. Maggie and I are very excited because we have spent, I don't know, several years, she and I've been working for many, many years to create a program to strengthen early palliative care capabilities, particularly in primary care practices and communities, community-based primary care. And we're calling today's presentation The Next Step, Strengthening Primary Care, and the program is called CAPACITI. And we're going to tell you all about it and how you can join and learn from it. We are excited because we are running this under the umbrella of the Palliative Care ECHO program led by Pallium Canada. So we are partnering with Pallium Canada to do this. And today, myself, Xian Xiao from McMaster University, and my research coordinator, Maggie Sivak. All right. Before we get started, a quick poll. What roles are represented here today to get you connected with us? And so you should see a poll pop up. And we'll let people fill that out. Okay, so registered nurses, social workers, spiritual care, paramedicine, and support workers, aides. Fantastic. Okay, a lot of registered nurses. Fantastic. Great. Okay, this is a program for you, for everyone on this list. Okay. Oh, we are sharing the results. Oh, I saw that. Okay, so that's the results of the poll. We have about a 40% are registered nurses. Fantastic. Everyone here, welcome. Okay, I'm going to close that. And we are curious, what palliative care education have you previously completed? I think this is another poll that is going to pop up.
Good, lots of LEAP.
Yeah, not a surprise. Okay, this one, we can probably, we'll give people 10 more seconds to complete the poll. But yes, the vast majority of you have done LEAP. There's a few people who have done fundamentals or CAPCs or other in the chat box. Well, wonderful. You're welcome. That's why we've partnered with Pallium, because we know they've been doing palliative care education for many years. And in many ways, this is sort of, hopefully after LEAP, this is the next step, or it could be seen as one of the next steps. All right. All right, let's jump in. So why CAPACITI? Because we've heard from people like yourselves. They've taken Pallium LEAP years ago or recently. They get excited, they, with their teammates and others. And then there is a time where they go back to their office and then they're trying to figure out, how do I apply this to my everyday work? How do I change my behavior? How do I change my practice How do we change some of the system processes and flows, particularly beyond just the clinical stuff, right? How do we, and especially early. So this is what we created, because we know, and you know, because you've taken leave, palliative care is not just about end of life. We are not trying to just introduce palliative care and the principles right when people are already, their fingertips are there and they're, days, maybe a week from death where they're already drowning. We're trying to introduce palliative approaches early on when maybe their ankles are in the water or they're knee deep in the water, and we have more time to prepare for that whole journey. Okay, we don't want them to be drowning. We want them to be prepared and learn how to swim. Okay. So another way of saying is how do we do that? So this is the program. We know end of life care is days, weeks, mostly cancer. This is who, in the old version of what palliative care is, this is what they thought it was. It's complex symptom management. Only, 0.1% of your caseload would get it. And if we try to push ourselves more, palliative care is, would you be surprised if they're, die in the next 6 months or the next year? Maybe 3/4 cancer. It's more of a holistic approach, physical, psychosocial symptoms. Maybe we're trying to reach the 1% of the population that we know dies every year. And the truth is, even when we do that, we're only getting people typically 1 to 2 months before death. What we are trying to do is talk about those things, but really push us to an early palliative care approach. And when I say that, what I mean is maybe years before death, right after or soon after they have a diagnosis of a serious illness. And it could be years that they live with it, but it will be a progressive life-limiting illness that will kill them, and a chronic disease that will progress and advance. That is a much more representative of heart failure and lung failure, frailty, dementia. And the focus here is on information, communication, education. There is some basic symptom management, the ABCs of symptom management. The complex stuff, maybe you have the expertise, you connect to consulting friend, the hospital, your special palliative care provider in your neighborhood, but you can do some of the ABCs. In fact, you're probably already doing it in the care and coordination. And that might be 5 to 10% of your patient population. So what we are trying to do in the capacity program through education modules is to show you how, not the, philosophically agree. It's the, what do you want me to do? So before I jump into that, and this gives you a little bit of the taste of some of the education materials we've created, I asked one of our colleagues, Dr. Erin Gallagher, who's a palliative care specialist trained, but she's actually a primary care doctor. Why should we even be talking about early palliative care and primary care? And we have a little short snippet of an interview we did with her. So Maggie's going to switch us over to YouTube and play that audio. Yeah, has it been your experience that the majority of patients and their families are really wanting you to be hopeful and positive? Is your experience that most of the time they're really resistant to anything negative? It's not even bad news.
Yeah,
Is that your experience or not so much?
definitely not so much. I find that far majority of patients and families want the information that we can provide without question. I think the people who don't want the information are the exception. I really do. Um, in family medicine, there are so few opportunities to have instant gratification. And this, oddly enough, is one of those moments where if you can sit down with a patient and a family and give them a clearer picture of what's to come in a time that seems so dark and confusing, and also give them a sense of control, again, so reframing that hope, right? Or as you guys talked about, walking two roads, right? It's the ability to massage those conversations to give patients clarity, and to give them a sense of control with that knowledge, that is like you can just see the shoulders drop in the room, right, in a good way. Sighs of relief, just thank you. The amount of times that you are thanked for giving what most people would label as bad news, right, or difficult to hear,
Mm.
um, a difficult to hear prognosis, is, I think, one of the most, 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 one of the it happens more than you probably can appreciate. But it has to be done well, and I think people have to have the confidence, not just the knowledge, but the confidence to be able to have these conversations with patients, and they are very well received if they're done well.
Could I just follow up? I was just going to build on that because I wonder if there are people listening going, why would I want to do all this extra work? What's the reward for you? Like, why do you do it?
Because it makes such a huge difference in people's lives, and it's not just the one patient sitting in front of you. It is anybody who's willing and able to sit in the room, whether it be my room or being in their home. I mean, family medicine is rewarding for a lot of ways, but it beats you down in a lot of ways too. It is really tough work. It is very busy work. And so at the end of the day, this is one way that I know that I am making a difference in people's lives.
I've been asked to start by.
Oh. Okay, so I think I did this right. Have I lost everybody? Am I sharing my screen? Yes. Okay, thank you. Okay, so that was Dr. Gallagher. She was on a podcast that I run with my colleague, Dr. Samantha Winemaker, who was also creating this program. And so she just talked about that. I don't think it is a bad place to start to talk about the challenges that you face in primary care, whether that's in your clinic or in schools or in the community. Community-based medicine has its own challenges, but its own rewards. And she talks about, ironically, talking about the future with patients is something that's rewarding. Okay. But we know that it's not so easy. There might the will or the, what is it? Anyway, the people, we've been talking about this for a long time. There are barriers that we need to overcome. What we have done in our program is talk to experts like Dr. Mary Lou Kelly about what some of those barriers are and how do we overcome them, and broken them down into steps. So this is another short video that we're going to just show, just to give you, again, a sampling of how we have set up our education program to get the best tips and advice from folks and putting them in short little tidbits so that you can digest them. And Maggie, if the closed captioning works, you can turn on.
That primary care teams face when taking on doing more palliative care, and also some of the strategies or tips that I've learned in how these teams that I've worked with have overcome them. There are 4 things that I'm going to talk about just briefly. The first one, which is pretty common, is that teams feel overwhelmed. Everybody in healthcare is working as fast as they can, doing as much as they can, and I believe they're often already feeling a lack of organizational support. So the first reaction I often hear is a sense of resistance, not because of lack of the importance of palliative care, but just, are you kidding me? That's one more thing to do. As I work with teams over the years and frontline healthcare providers, I think I've learned that one of the solutions is for them to realize that they are already doing most of what it is that they need to do to provide excellent palliative care. It's in many ways just good quality care that people are already doing and being expected to do. What's different is getting a little bit organized about it and a little bit more systematic. I sometimes have providers think about, when we were providing palliative care to this particular client, things went extremely well. And then think a little bit about, well, what were the elements that made it go so smoothly? What were the value added? And those are the kind of things really this whole capacity project aims to try and highlight. But highlighting them and then trying to be a little bit more systematic. And at the end of the day, it turns out actually to be less work. The second one is reframing the meaning of palliative care or the palliative approach to care for yourself and others as an added level of care. This is not generally how the general public and sadly how many healthcare providers think about the palliative approach to care as an added level of care. They immediately focus on what is not going to be done. Hope will be removed, access to treatment and interventions will be removed. And there's a real focus on that. But we in the field know that palliative care is really about focusing on what each of the members of the healthcare team can do to add to the quality of care on a day-to-day basis. yes, the context of the whole thing is the person is in the last stages of life. And because 100% of people die, there's a lot of things that we can't really change. But if the emphasis and the focus of your care and your conversations is what we can offer in the way of quality pain and symptom management, psychosocial, spiritual support, really focus on the things that can really make a difference in a day-to-day basis. The third one that I hear from providers in most of the settings I've worked in, which is rural communities, First Nations communities, long-term care homes, they really worry about the lack of social support and the sense of social isolation that they often find themselves in, and making decisions or providing care, often when they're on their own in a home or working a shift in long-term care, and there are only a very few people there. And so what I think the solution there is to spend an awful lot of time on an ongoing basis, just building the relationships within your team. I went and visited a really excellent rural palliative care team a number of years ago, and I asked one of the providers, what was the secret to success of your team? And this provider said to me, I never feel like I'm alone out there. I'm in the home and I'm making the visit, but I feel absolutely confident that if I need to call another nurse, if I need to call a physician, if I need to call the pharmacist, they will be there and they will answer my questions and they will support me. And these, of course, are all of CN Sau's PEP framework, the things that make a really effective team: trust, communication. But I can't stress that in my own work, having those operationally in a team make a big difference in solving that ongoing fear that people feel socially isolated and are really anxious about the responsibility of providing palliative care in the community. And the last.
Okay, are you seeing my screen again? Great. Okay, so we know that there are barriers. Those were two sort of examples in our education program. We would talk about those barriers. We would hear tips from how they've addressed them. We would convert them into action steps. So we know there's confidence and skills and time. And so we really try to encourage or explain to work differently, not more, to link up to the basic skills you're already doing and all of these, and using evidence-based tools and pro tips. It's less about the tools and more about the tips and the how people think about it, how they actually do it. And we break them into little steps so that they're achievable and you can do them. And that's what our program is trying to do. So we've done all this legwork to talk to people. We've created this program, and I'm going to turn over to Maggie to talk more about the program that we are recruiting for right now.
Thanks, Jan. Next slide. So what is CAPACITI? CAPACITI is an education program that's designed for primary care teams. It provides you with practical tips and strategies that we've incorporated from experts across Canada. And it really shows you how to incorporate the early palliative care approach into practice. So it's very, very practical. Lots of tips, lots of tools, lots of case studies and videos. And we've designed 3 modules, which I'll get into in a little bit, that can really be taken in any order. Next slide. So I think I'm going to show you a promo video right now that just kind of describes CAPACITI. So there we go.
Welcome to CAPACITI, a program designed to support primary care teams who want to incorporate an early palliative care approach into their practices. CAPACITI provides practical tips and strategies so you can change your practice in simple and concrete ways and start making a difference for the patients and families that you serve. Our content was created by experts from across Canada. They've been delivering early palliative care for their patients for many years, and they've shared their best tips and advice with us. We put it together, and now the program is ready for you. CAPACITI offers 3 modules that can be taken in any order. The module Identify and Assess Like an Expert will help you use tools and case studies to identify and assess palliative care needs earlier. The module Enhance Communication Skills will help you improve your communication skills regarding serious illness in ways that are simple, natural, and acceptable to patients. And the module Enhance Skills for Ongoing Care will help you to navigate the system to provide coordinated and seamless care. Let's hear from nurse practitioner Tina Ippolito on what she learned while taking the CAPACITI program.
Overall, I found it very helpful. I especially appreciated the information on early identification and assessment because, in school and even in acute care where I come from, we focus on end of life. That's it. Palliative care equals end of life. And that is not the case, especially in primary care. We get to know these patients really well throughout their lifespan, and they really appreciate having somebody they know support them when, illness hits. And so being able to know how to do that and not find it as scary and know that it is something that we can do is really helpful.
When you sign up for Capacity, you get access to so many resources to help make changes to your practice. Each module has case studies, expert videos, audio recordings, quizzes, cheat sheets, and templates for you to use. All of the materials are available online to registered participants throughout the course. We wanted to make it easy, relevant, and actionable for you and your practice. Here's what some of our past participants have said about the Capacity program.
The modules were well thought out. The speakers were good, and the exercises were thoughtful. It had a lot of good resources.
These sessions have provided an abundance of information to guide providers in initiating and engaging clients.
Capacity was very inspiring. We identified what we needed to do and work on to get everybody on board to do this.
Are you ready to join Capacity? Enrollment for our 3 modules is available now on a first-come, first-served basis, so don't delay. Go to palliativecareinnovation.com to find out more about the program, how to register, or how to sign up for an informational webinar. So team.
Okay.
Okay, so.
All right. So the benefits of taking Capacity, really, there's so many of them. So we hope by the end that you'll have an increased knowledge, more job satisfaction, more proactive practice, increased collaboration with your team, increased confidence in your ability to provide early palliative care. And also for those of you who are working towards a quality improvement plan on palliative care or frailty, Capacity can really help you achieve this. So please feel free to reach out if you want to discuss more about that. Next slide, Sam. So if you want to join, we are looking for generalist primary care providers, so not palliative care specialists, who are really looking to embed palliative care into their practice. So we do encourage primary care teams to apply together as a team, but if you are interested in doing this on your own, that's totally fine too. So we do accept registrations from individual providers, and really anyone can apply. So nurses, nurse practitioners, social workers, main office assistants, admin assistants, executive directors, anybody who is involved in the palliative care approach within the team is welcome to apply. So term 1 starts November 2021, and in a few slides, I'll show you the actual timeline so you can see. Next slide, Sam. So just want to go into a little bit more about the modules for you here. So module 1 is really about identifying and assessing patients. This is the first module. So we really, if you're going to take them in order, we recommend that you start taking it with this module first. So it's the most introductory module where we look at how you can identify palliative care needs earlier with your patients and how you can track them over time, how you can embed very simple assessment strategies into your practice and use different tools for assessing complex symptoms. Next slide. So module number 2 looks at enhanced communication skills. So this module really looks at how you can have simple and natural conversations with your patients about advanced care planning, illness understanding, illness education, how you can explore their goals and values, and how you can really weave in advanced care planning and goals of care discussions in ways that are actually natural. So in this module, we have lots of case studies. We provide you with lots of examples where you can watch how different providers have conversations, and then you'll have some time to kind of practice it yourself and pick out key phrases that you think you might like to use. So this module is very, very practical. Next. The final module, module 3, is really our most advanced module. And this is the one that we would say that is really beneficial if you take as a team. So this is for people who are really, really good. They already have the identification and assessment down. You're very comfortable having conversations, and now you kind of want to take it to the next level. So in this module, we'll look at how you can really establish your role with your patients in providing continuing of care. So how you're going to be with them along this journey, how you can really use your external resources for support. So looking outside your inner team and at things in your community that are there. So pharmacists, social workers, that type of thing. We'll also look at how and when to engage the specialist for help. So when I say specialist, I'm referring to palliative care specialists as well as the other ologists. So when you might want to consult with the oncologist or the cardiologist, etc. And then finally, this module ends with looking at how you can include the caregiver as part of the care team. So we actually include caregivers in this last module, and you can really hear from them about how they know information that you as a provider would never know about the patient, and how they can really, really help you out in caring for patients. Next slide. Okay, so I'm going to launch a quick poll based on what you've seen and what you've heard, which actually, Sian, can you launch the poll? It's not, let me see, where did it go?
It's okay. I
Okay.
don't, oh, you got it? I actually can't.
No, I don't have it. I don't know where it went. Anyway,
That's-
sorry about that.
That's
But,
okay.
if you want to type in the chat which poll you're interested in attending, that would be great.
It's okay. We'll keep going, but we are trying to obviously, you know, share what we're trying to do and get people excited. As you'll see with this slide, what we found is the majority, 99% of people who have signed up have done them in order. And that's particularly important because if we don't have enough registrants, we can't offer that class. So knowing that people are taking them in order is going to help. So I'll turn it over to Maggie.
Yeah, so on this slide, you can see that we have the terms outlined, and the whole capacity trial will go for 18 months. So we're starting in October of this year, and then it's going to go all the way until 2023. So each term has its own registration deadline, and we are encouraging teams to only sign up for one module per term. But if you want to take them in order, next slide, Sian. You'll see that this is the arrow that we're suggesting. So as Sian alluded, we do say any module, any order, but we've already had a lot of people sign up. And what we're noticing is that people are taking them in order, where they're taking module 1 in term 1, module 2 in term 2, and module 3 in term 3. So if you're going to sign up and take all 3 modules, Sian, go to the next slide for me, you can see how the arrows will line up. So you'll be able to take them nicely over a 9-month chunk. So it's not too, we're not making you go too fast. You have some time as a break in between, but there's lots of opportunity for you to sign up for all 3 modules over the next 18 months when we'll be offering this trial. So just to give you some more information, each module is about an hour bi-weekly. So for a total of 4 hours of learning time over 2 months. And if you are, we're going to get into this in a second, but the facilitated learning sessions will happen from 12 to 1 Eastern time, but you'll have access to all the content and the self-directed modules that you can walk through anytime. Next slide, Sam. So how does it work? So it's starting in November, as I already showed you on the previous slide. Because this is a CIHR funded project, it's free, which means that there's no charge. So this is a fantastic time for you to take this program because it's not going to cost you anything. So jump on board now before it becomes not free anymore. It's available to anybody. So as I said, anyone will get access to all of the content. And then because this is a research study, half of the teams are going to be will be randomized to get facilitated learning in addition. So half the teams will get access to a live presenter, Sian, from 12 to 1, and we'll walk you through all the content. And the other half will just get access to the content. So both groups will get access to everything. However, one half will actually get facilitated learning and the other half will get self-directed learning.
So you're free as a team to use, we'll book the time in your calendar just every 2 weeks, 1 hour, and you're free to connect with your own team to take them together or what have you, but we won't facilitate that for you. And the other thing is we just got accredited for CME credits. So for every hour that you watch, fill out the quiz, you're eligible for a CME credit, main pro credit, or you know, you will get a certificate for participation for 1 hour of credit. So each one will be 4 hours max.
Yeah, so whatever your regulatory college is, we're happy to provide you with, we'll give you certificates that document however many hours of capacity you completed. So you'll be able to use that towards your professional development. Next slide, Sam. So what makes a good team? So we've learned a lot through wave 1 of capacity, and some things we saw that allowed teams to be not so successful where teams signed up and they had different team members across different sites and they didn't really talk to each other. They didn't really know what was going on. Teams where not everyone was on the same page. So if the work was not a priority, teams where there was not one person to hold everyone accountable. So no team lead kind of encouraging people to complete the work. If team members didn't come to sessions, obviously we didn't see great outcomes from them. And if there was just no support or buy-in overall from the organization. So to overcome all this, we really suggest that, if you're going to sign up as a team, sign up with people you know, people you do the work with, people you share a common vision. Have one person be the team lead. So this person is like the champion, the cheerleader, makes everybody come to the sessions, make sure that everyone's doing the work and doing the assignments and staying on top of it, and really dedicate the time to do it. So like Sian said, we'll provide you with the Zoom link. So please make sure that those are in everyone's calendars. If you're not facilitated, you can still have that dedicated hour every 2 weeks where people are doing capacity. And then just try to get buy-in from your top to make sure that they are really supportive of this work. And if you're, like I said, if you're doing this as part of your quality improvement plan, this is a great way to meet that.